Have you ever wondered what is the true cause behind long COVID? Today, we're going to look at what the science says. We're going to specifically look at research articles on what long COVID possibly can be the cause. And we're going to approach this with a common sense perspective. So let's get right into it. The medical system that we currently have does a horrible job at understanding the unseen, things that you cannot see. Now, why do I say this? When you go to the emergency room, urgent care, primary care, to any of your doctors, what do you get? You get an x-ray, a CAT scan, an MRI, blood work. And within that blood work, they try to measure certain levels, cholesterol, triglycerides, your hemoglobin, your hematocrit, the coagulability of your blood. They try to measure, they try to look, observe if something is off or broken. But for example, something like PTSD or certain mental health illnesses, they're extremely hard to diagnose. Why? Because they are unseen. For example, you can be having panic attacks every night. Talk to a psychiatrist. Maybe it's the first time you've seen one. They don't want to diagnose you with PTSD. They're unsure. They want maybe weeks or months to evaluate you before they can diagnose you with PTSD. Why? Because it is hard in the scientific framework that we live in to diagnose the unseen, things that you cannot see. Self-healing is not really promoted and it's not really researched well. Most of the treatments and the medications you get are just there to really support your body to do the healing. It usually doesn't do the healing in your body. But the medical system that we currently live under, most of the time, they tell you you need to take this, you need to take that so that you can heal. I'll give you an example for this. If you go to your doctor's office and you have some sort of bacterial infection, what ends up happening? Your doctor will prescribe you an antibiotic. Now, does that antibiotic cure whatever bacterial infection you have? No, it doesn't. What the antibiotic does is reduce the bacterial load in your body. Meaning, if I'm giving an example of this, if you have 100 bacteria in your body, the antibiotic kills 30 bacterial particles in your body, and your body will do the rest. So all it does is reduce the bacterial load so that your body can have an easier, maybe even a faster chance at defeating this bacteria. But your body is the one doing the work. When we have a fever, we tend to take something like Tylenol or Advil. But do they cure your fever? These medications just stop the enzymes from being produced in a certain process, and it stops from your own body creating the fever. It doesn't cure you. Where you can really notice a flaw in the medical system that we currently have is take something like type 2 diabetes. If you ever go to your doctors, they'll tell you there is no cure whatsoever. If you do a quick Google search, you will notice there is no cure for type 2 diabetes. Yet, people are well aware that if you eat a healthy diet, you can reverse type 2 diabetes. For example, you look at my father, he eats extremely healthy and he will get rid of his type 2 diabetes. And then he starts eating horrible, and then his type 2 diabetes spikes up, his blood work shows up that he is diabetic, and then he'll just go back on a diet and he's just going up and down. His diabetes disappears and it reappears. But under the medical system, it says that it's impossible. There is no cure. Let's make something very clear. The pharmaceutical business is a business. Most of them are public traded companies, meaning that they have shareholders. So they invest in research that will support profit, that will help them create a medication that they can sell and create profit for the company. That is its job. It is a business. It is not a charity organization. If you go to any of the websites of these big pharmaceutical companies, or you go to the doctor's office and you say, hey, this pharmaceutical company, have they been promoting meditation, yoga, breathing exercises, living a less stressful life, learning to incorporate joy in their life? We can agree that these things would be beneficial for the whole entire world. And these businesses are made of billions of dollars, billions and billions of dollars. Yet they don't promote those things. Why? If these pharmaceutical companies' first interest was the people and your health, then they would probably promote those things. But they don't. Why? Because again, it is a business. Now, don't get me wrong. I'm not here to start a revolution against the pharmaceutical companies. I'm very grateful for the pharmaceutical companies. They have created life-saving medications and treatments, so I am 100% grateful for them. But they have their place. But the point I'm making is that it is first a business, and your business is your health. Honestly, I was a little naive before I got sick, and I thought, well, these pharmaceutical companies, they must have my interest in first place. Is that true? Are these pharmaceutical companies putting their patients first? Well, let's take a look at this Wikipedia page, and you can see here the list of largest pharmaceutical settlements. And if you look down the page, you'll see these big pharmaceutical companies. You're looking at GSK, Pfizer, Johnson & Johnson, Abbott, Eli Lilly, and you can see the whole list of all these different pharmaceutical companies. And you see that they have been sued and they lost 3 billion, 2 billion, 2 billion, 1 billion, not million, billion. Why? Well, let's take a look. It says here, criminal off-label promotion, failure to disclose safety data. Civil, paying kickbacks to physicians, making false and misleading statements concerning the safety of Avandia, reporting false best prices and underpaying rebates owed under the Medicaid drug rebate program. So they've been criminally charged and they have off-label promotion and kickbacks. Let's look at what that even means. Off-label promotion is also referred to as off-label marketing, which is the unlawful practice of a company marketing its pharmaceuticals or medical devices for uses that the FDA has not approved. So for the pharmaceutical company to ignore the FDA and not get approval for a certain use is a big deal. Another charge they have is kickbacks. And what is that? Let's take a look. It says it's rewarding or inducing providers to prescribe certain medications by doing what? By providing drug samples, expensive meals, travel, tickets to sporting events, golf outings, or other entertainments, or maybe even certain gifts. So the pharmaceutical companies are, in a sense, paying certain providers so that they can prescribe certain medications. If you want to dig into this more, I will let you do your own research at your own time. But you can see that these companies, thinking that they're extremely ethical, well, as we can see, maybe the people in them aren't ethical. My next question is, why are these companies looking for cures and medications only? There isn't money in suggesting meditation, living a peaceful life, learning to reduce stress, yoga, breathing exercises, changing your diet. There's not much money doing that. Please keep in mind, I am not a doctor, a medical doctor. I'm not a medical researcher. I am just a guy on the internet. Please speak with your healthcare provider if you have any questions. Well, now we're going to get into the nitty-gritty. Let's look at certain theories of what is the cause of long COVID. So there's this study in the World Journal of Virology, and it's called Idiopathogenic Theories about Long COVID. Idiopathogenic just means that they don't really know it's a spontaneous cause. They don't really know the cause of long COVID. So there's these idiopathogenic theories, ideas of what long COVID and the cause of it could possibly be. And let's take a look. There's a list of possible ideas these scientists and doctors have. So please, let's go down. And it's going to be the number one. It's going to be theory of endothelial dysfunction. So I'm just going to explain this to break it down for you guys so it's easier to understand. So endothelial dysfunction, endothelial is just the name they have for what's inside your veins and arteries. So they believe that one cause is the dysfunction of your arteries and veins, that there's too much of a constriction, and that's what causes fatigue and all these long COVID symptoms. So they're saying that's one theory, that the lining of your arteries and veins are somehow dysfunctional, that they're not constricting and dilating correctly. They're just staying hard and constricted. The next one is the theory of platelet hyperactivity. This just means that when you have too much platelets, it's really looking at the coagulability of blood, meaning how does your blood coagulate or how does your blood start clotting? If your blood starts clotting too quickly and there's too many platelets, what ends up happening is that you have blood clots. And we know that blood clots are very dangerous because if a blood clot travels to your lungs or to your brain or to your heart, that's considered a heart attack. If it's in your heart, it's considered a stroke in your brain, and it's also considered a pulmonary emboli. It's when it goes to your lungs, and it can kill you. Any of these can kill you and really affect your life. So blood clots are extremely dangerous. So they're saying maybe there is this platelet hyperactivity. People with long COVID tend to have more blood clots, or their blood signatures, like their D dimer, comes back high, or there's just too much coagulability or hyperactivity of your platelets. I hope that makes sense. Crucial nerve damage theory is just taking a look at your vagus nerve and seeing if it was somehow damaged in some way, shape, or form. Theory of immune abnormalities. This really is meaning that your immune system is just everywhere. It's not behaving correctly, maybe even autoimmune. Your own immune system is attacking itself. Theory of interaction with subclinical viruses just means that they believe that some viruses are dormant in your body and they come back out, and we have other viruses in the past and they're still in our body, and there's some sort of interaction with past viruses and it's causing long COVID. Dysbiosis theory is just pretty much the gut-brain connection. So they're saying that your gut somehow, maybe it's damaged, or the microbiota is somehow imbalanced and it's causing your long COVID symptoms. Theory of aggravation of chronic disease, or the novel appearance of chronic diseases. This just means that you've had chronic diseases or comorbidities before getting COVID, before getting long COVID, and that all of a sudden when you get COVID or long COVID, now it comes together, and with these different types of chronic diseases, they add together, they stack up, and now they cause long COVID. Let's look at what this study says there. People are trying to do, scientists, doctors are trying to do to find the cure for long COVID. Let's take a look. So here, Dr. Iwasaki from Yale University leads a clinical study using Paxlovid. Paxlovid, that's weird. Let's take a look at what Paxlovid is. Oh, Paxlovid. If it's COVID, Paxlovid. That's catchy. So Paxlovid is owned by, if you scroll down, by Pfizer. Great. So here, let's look at that research study. It says that they're trying to give Paxlovid for 15 days and seeing if it works. So they're giving a medication and trying to see if the medication is curing the disease. Let's look at another researcher, Dr. Theresia Pretorius, sorry if I'm messing up her name, are addressing the theory of immunothrombosis. Immunothrombosis means your own immune system is creating thrombis. Thrombis or thrombosis is just blood clots. So they're saying that your own immune system is creating blood clots. And what are they doing to find the solution for this? It says that they're using special therapy called triple therapy, which uses oral anticoagulants, medications, dual antiplatelet therapy, medications, and gastric protection, from which encouraging results are expected. Great. The next one, Tamara Ramanuk and Ale Frost, who addresses the theory of dysbiosis. And what are they using? If you look down, it says they're antibiotics, medications of doxycycline and amoxicillin with clavulanate. And they believe this is due to neuroinflammation and neuroimmunology. So they're saying that somehow in your gut, if you're using these different types of antibiotics, that somehow it will prevent the inflammation in your gut, which is weird because if you look at gut-brain connection, you want a healthy bacteria in your gut. And these antibiotics is a nuke. It would destroy the bacteria, the healthy bacteria and the bad bacteria in your gut. Is this the way? In Spain, researchers address the theory of damage to the vagus nerve. And pretty much what they do is they're going to take ultrasounds of the vagus nerve and see if there's some sort of shape difference, if they get smaller, if there's some sort of damage, physical damage to the vagus nerve. In Switzerland, there's a research protocol being done with monoclonal antibody called temelibalab. I can't even say that. So this is a medication. They're testing to see if there's a medication that can cure long COVID. In the conclusion, I want to read something to you guys. It says there is still much to be deciphered in the idiopathogenesis, or the cause, and pathophysiology. Pathophysiology just means the understanding the mechanism of how the disease works. So it says that they're still having trouble with the idiopathogenesis and pathophysiology of long COVID. In other words, they're telling you no one understands the cause of long COVID. I think the biggest doubt most people with long COVID have, that polyvagal theory or mind-body syndrome or cell danger response, all these different things, that the biggest doubt they have is the one that I hear the most is spike protein. The reason I have long COVID is because of spike protein. Let's look at a 2022 article about spike protein. So this is on Scientific American. There's an article that says people with long COVID may still have spike protein in their blood. And they're saying that this is maybe a biomarker indicating that there's some sort of infection in their blood. So let's go down to this paragraph. The paragraph says, the intact spike protein found in patients' blood could indicate that infected cells missed by the immune system are to blame for long COVID. Our main hypothesis is that the spike protein is not causing the symptoms, but it's just a marker that is released because you still have the infection of some cells with SARS-CoV-2. The spike proteins do cause inflammation in the body and these different types of damages in different parts of your body. But we're not talking about if spike proteins are causing inflammation or damage in your body. We're talking about, is it causing long COVID? Here, the scientists are saying that they don't believe actually that the spike proteins are actually causing long COVID. They believe that these spike proteins are floating in your blood and that your immune system is attacking these spike proteins. And that is the idea or the hypothesis on why they believe it could be long COVID, the cause for long COVID. If you believe that spike proteins is the cause, you truly believe this is the cause of long COVID, just know that there are studies coming out with different home remedies in a sense. There's different supplements you can take to get rid of these spike proteins from your body. And it's been shown to reduce the spike proteins in your blood. Something like this study here, the degradative effect of nattokinase on spike protein of SARS-CoV-2. That's a study. Bromelain, there's another study showing bromelain. I think there's another supplement that you can take. Please talk to your doctor or healthcare provider before you start doing this on your own. So you can take these supplements after talking to your doctor. And if this theory is true, then if you take nattokinase for a few months, maybe a year, you would be cured from long COVID, if this was true. Another paragraph in this article, it says, this hypothesis lines up with other evidence that COVID infects more parts of the body than just the lungs, including studies that have found SARS-CoV-2 in deceased patients' organs. This preprint study doesn't rule out other possible causes of long COVID. However, particularly because not all of the long COVID sufferers had the spike protein in their blood. So in this study, it shows that not everybody that suffers from long COVID had spike proteins in their blood. So if you're one of these people that truly believe that is the spike protein, you really need to think about this. How is it that it's possible that there are people with long COVID that do not have detectable levels of spike proteins in their blood? Another possible cause many people tell me is my mitochondria is not working. They're damaged. That is what's causing long COVID. Well, let's take a look at that. There's a study here, Understanding Long COVID, Mitochondrial Health and Adaptation, Old Pathways, New Problems. This is a study just evaluating, are the mitochondria's damage? Is that the cause for long COVID? Well, it's a long article, beautifully made. You can take a look at it. I'll link it in the description below. But let's go to the conclusion. Scroll down to the conclusion. Let's see what they conclude from their own study. As a generalization, it could well be that many people can be tipped into a chronic dysmetabolic inflammatory cycle. So they're saying that when you have these diseases, somehow it tips your immune system to somehow kind of break, and all of a sudden your immune system is causing all these long COVID symptoms. They themselves are not saying that the cause of long COVID, they have not found that the cause of long COVID is because of your mitochondria. That's why when you take certain supplements to boost your mitochondria, it does not work. I've tried it. Let's look at another interesting story that has to do with your mitochondria. This study was done in 2018. Psychological Stress and Mitochondria, a Systematic Review. And let's look at one of these paragraphs here. It says here, first, chronic stress induced through a form of psychosocial stressor decreases mitochondrial energy production capacity and alters mitochondrial morphology. If you go to the next paragraph, it says, second, acute and chronic stressors have different and in some cases opposite effects on mitochondrial functions. Acute stress may damage mitochondrial structure within hours and enhance certain aspects of their function. Doesn't this sound familiar? If you think about the fight or flight, whenever you're in acute stress, you have so much more energy, meaning that your mitochondria has to go into high gear. That's what it's saying here. But it can also hinder your mitochondria's function if you're under stress for too long. Can this be what's causing and affecting your mitochondria's health, in your energy production, in your fatigue? I don't know. I'm not a doctor. Another theory is this endothelial dysfunction. It's the cause of long COVID. Well, let's take a look. Can there be another explanation? Let's look at this article from 2011. how mental stress affects endothelial function. It says here, acute mental stress by a variety of tests impairs, causes dysfunction, endothelial function in humans, although the opposite results have been reported by some investigators. Chronic stress always deteriorates endothelial function in humans and experimental animals. And it says in the bottom paragraph, inhibition of cortisol. Cortisol is released when you're under a lot of stress. That's the stress hormone. So it's inhibition. It means preventing being released, the stress hormone cortisol, and endothelin 1 production, prevention of pro-inflammatory mediator accumulation, hypnotics, mirthful laughter, humor orientation, and lifestyle modification would contribute to the prevention and treatment for stress-related endothelial dysfunction and future serious cardiovascular disease. I'm going to read certain points that I feel like are very important. It says that hypnotics or mirthful laughter, humor orientation, and lifestyle modification would contribute to the prevention and treatment of endothelial dysfunction that is caused by stress or fear or panic. What is mirthful laughter? That's what we call nowadays laughing yoga. Purposely making yourself laugh without any stimulus from the outside. Just making yourself laugh. So they're saying that making yourself laugh, having humor in your life, and certain lifestyle medications can help you prevent endothelial dysfunction or impairment. Let's look at another article here. It says body's response to repetitive laughter is similar to the effect of repetitive exercise, study finds. It says here joyous or mirthful laughter is considered a positive stress that involves complicated brain activities leading to a positive effect on health. Noman Cousins first suggested the idea that humor and the associated laughter can benefit a person's health in the 1970s. He said he was diagnosed with autoimmune disease, documented his use of laughter in treating himself with medical approval and oversight into remission. He published his personal findings in the New England Journal of Medicine and considered one of the original architects of mind-body medicine. He cured his autoimmune disease through laughter. Very interesting. The next theory is the theory of platelet hyperactivity. And just to make it simple, it's pretty much the theory of blood clots. They believe that having blood clots in your body is what's causing long COVID. If you have long COVID, I'm pretty sure you've already looked up things about blood clots. You've heard about it. You've read about it. And there's some people, even I think it's in Germany and other countries, that have done something called apheresis. Apheresis is when they take your blood out of you through a machine and they filter out the blood clots and they return the blood back to your body. Pretty much they're filtering out these blood clots. The person that reached out to me and told me that they went on this machine, they said that they felt great after a few days, and within a week, they had all their normal symptoms back. So what can possibly be causing these blood clots? Let's take a look. This is a study done in 2008. Anxiety linked to blood clots. Fear that freezes the blood in your veins. I can't find the original study, but this is sort of a summary of it. And so we can read here, it says, for it turns out that intense fear and panic attacks can really make our blood clot and increase the risk of thrombosis or heart attack. Earlier studies showed that stress and anxiety can influence coagulation. In this study, they took 31 healthy patients and 31 patients that suffered from anxiety disorders. And pretty much they made them take a test. And in the end, the conclusion was the group of anxiety patients showed a much more highly activated coagulation system than the healthy control group. Meaning that if you have more anxiety, more fear, more fight or flight, that your coagulation factors increase according to this study. Can that be the cause of people with long COVID having blood clots? Well, let's look at another study. Here, there's a study from 2020, impact of acute and chronic stress on thrombosis. Remember, thrombosis is just another word for blood clot in healthy individuals and cardiovascular disease patients. Let's read this paragraph. It says here, the autonomic nervous system is divided in the sympathetic nervous system and the parasympathetic nervous system. Remember, they're not aware of the polyvagal theory. So, right, they're talking about it just a bivagal theory, which is two. But let's continue reading. It says there, which promote opposite effects. The SNS stimulates the body's fight or flight response, while the parasympathetic activates the body to rest and digest. Under normal condition, a stressful experience triggers the activation of the sympathetic nervous system that in turn promotes the production and release of catecholamines from the adrenal medulla. Catecholamines are just things that cause inflammation in your body. On the other hand, the parasympathetic nervous system is activated when the stressful situation is diminished and by releasing mainly acetylcholine. It plays a key role alleviating the stress response by inhibiting or preventing the sympathetic nervous system and HPA axis. I'm not going to get into that today about the HPA axis. However, during chronic stress, the sustained sympathetic activity and reactivity, which is not counteracted by the parasympathetic nervous system, results in enhanced cardiac tone, platelet activation and aggregation and coagulation, endothelial dysfunction, and inflammation. Meaning that if you are too stressed and too much in the fight or flight, your body starts increasing its platelets, which causes blood clots, increasing coagulations, which is blood clots. It says here causes endothelial dysfunction, which we just read studies on those, and increases inflammation. That's weird. Can that be the cause of long COVID? I don't know. I'm not a doctor. So there's another study done here by the British Medical Journal. It says long COVID patients seeking experimental blood washing abroad. So these are the people that were doing the apheresis, or it's sort of like dialysis for the blood. They're filtering out the blood clots from patients' blood and seeing if it works. Keep this in mind. Why is this being studied? Well, according to this paragraph, it says after visiting the long COVID center in Cyprus to receive the treatment at a cost of more than 15,000 pounds or $15,000, according to this paragraph, says she returned home with no improvements to her symptoms. She received 6 rounds of apheresis as well as 9 rounds of hyperbaric oxygen therapy and an IV vitamin drip at the private clinic. And if you go down another paragraph, it says there, it's unsurprising that people who were previously high functioning, who are now debilitated, can't work, can't financially support themselves, would seek treatments elsewhere. It's a completely irrational response to a situation like this, but people could potentially go bankrupt accessing these treatments for which there's limited to no evidence of effectiveness. And the last paragraphs end with, if we don't know the mechanisms by which the microclots form and whether or not they are causative of disease, it seems premature to design treatment to take the microclots away, as both apheresis and triple anticoagulation are not without risks. Meaning that in this study, they are not sure what is the cause of long COVID. People have spent thousands and thousands of dollars filtering their blood with no results. Well, let's look at another theory, the crucial nerve damage theory, which just means that they believe that maybe there's some damage to the actual vagus nerve. Let's look at this study here. It's called Vagus Nerve Inflammation Contributes to Dysautonomia in COVID-19. In the second paragraph, you'll see here, it says the vagus nerve is an essential component of the autonomic nervous system and regulates critical body functions such as heart rate, digestion, and respiratory rate. Dysautonomia is observed in long COVID and other neurological diseases, which might be explained by vagus nerve impairment. So they're saying that dysautonomia, what does that mean? A dysregulated autonomic nervous system. I think that's what it means. I wonder if there's a theory out there talking about this. They think that there's possible impairment, damage, or just a lack of functioning, incorrect functioning of the vagus nerve that can be causing long COVID. Let's look at another theory, the theory of immune abnormalities, or pretty much autoimmune. Well, let's look at this article done by JAMA, which just stands for the Journal of American Medical Association. But the study is, the name of it is Association of Stress-Related Disorders with Subsequent Autoimmune Disease. And again, we're just going to scroll down. We don't want to read this whole thing. The conclusion made in this Swedish cohort, exposure to a stress-related disorder was significantly associated with increased risk of subsequent autoimmune disease, compared with matched unexposed individuals and with full siblings. Further studies are needed to better understand this mechanism. It says here that people with increased stress-related disorder are more likely to have autoimmune. It means that stress affects your immune system. Let's look at this study done by Biological Psychiatry. It's a study evaluating veterans, American veterans that went to war in Afghanistan. It's called Elevated Risk for Autoimmune Disorders in Iraq and Afghanistan Veterans with Post-Traumatic Stress Disorder. Again, we're going to go to the conclusion here. And it says here, our results indicate that young veterans diagnosed with PTSD have significantly increased risk for diagnosis with autoimmune disorders with definitive diagnostic criteria. So they're saying if you're in a panic, if you have a panic disorder, an anxiety disorder, that you're increased risk for autoimmune, meaning that your immune system will get confused and start attacking itself. Interesting. Let's look at this article done by Harvard. And the name of the article is Autoimmune Disease and Stress. Is there a link? And let's first see what they define as stress. It says a common definition of stress is any experience that causes tension, whether physical, psychological, or emotional, especially if it sets off the fight or flight response, during which the adrenal gland releases adrenaline, leading to rapid pulse and breathing and increased blood pressure. This serves as well if chased by a lion, but it's theorized that persistent stress could lead to chronic disease such as high blood pressure or autoimmune disease. If we keep going down, and it says that the connection it's made in a specific research article, it found that people with a stress-related disorder were more likely diagnosed with autoimmune. They were more likely to develop multiple autoimmune and had a higher rate of autoimmune diseases if younger. So Harvard is saying that if you are more stressed in life, you are more likely to have an autoimmune disease. Can that be the cause of long COVID? I don't know. I'm not a doctor. Another theory is the theory of interaction with subclinical viruses. So this theory just believes that certain viruses, even old ones, when they're together and mixed up, they're dormant and they wake up. I didn't even bother looking into this. I just don't believe it's one of the causes of it at all. So I didn't even bother looking into it. But that is a belief they have. They believe that the Epstein-Barr virus or the herpes zoster virus somehow can be reactivated because of COVID and causing long COVID symptoms. That's something you can search up if you want. Another theory is the dysbiosis theory, the theory that our gut bacteria is somehow involved in causing inflammation neurologically and somehow causing long COVID symptoms. When I was on my recovery journey, I tried taking all these different types of brands of probiotics and eating a special diet, hoping that maybe that was the cause. From my personal experience, that did not help me at all. The studies that they are looking into are fecal transplant. And you can see here, I wonder why they're looking into fecal transplant as an alternative or as a cure or a treatment for long COVID. Well, here you can see that according to Michigan Medicine, the cost of 1 unit of fecal transplant, it's $1,695, almost $2,000 for 1 unit. You will need a few units for a correct fecal transplant to have the correct effect. Is that the cure of long COVID? I don't know. I'm not a doctor. Another theory is the theory of aggravation of chronic diseases or de novo appearance of chronic diseases. This just means that there's different comorbidities, chronic illnesses together, and that's what caused long COVID. To me, it doesn't make much sense, but that is a theory. Another theory is viral persistence, and this is why they are creating the medication, or they've created the medication and doing studies on Paxlovid, which is a website we've showed you before, and it prevents the virus being replicated. And so they think that maybe this is a viral persistence causing long COVID. There are people that have taken, I know, Paxlovid and did not improve at all. Some of you are probably watching this. So in the end of watching and listening and listing all these different theories, the one conclusion that we can all make is that no one knows the true cause of long COVID. No one. So do you think that the medical community will ever find the cure for long COVID? I hope I'm wrong, but I'm pretty confident that it will be a long time or we will never get the cure for long COVID. And why do I say this? Well, let's first look at a list of symptoms of long COVID. Wow, you have fatigue, post-exertional malaise, headaches, sleep disorder, impaired reasoning, impaired memory, impaired attention, which is pretty much brain fog, secondary depression, secondary anxiety, reduced activity, myalgia, muscle weakness, hot and cold spells, poor appetite, orthostatic intolerance, or some people may call it POTS, palpitations, breathlessness, nausea and diarrhea, chills, cough, painful lymph nodes, chemical sensitivities, tinnitus. Isn't it so funny and weird and coincidental that long COVID has similar symptoms side by side to chronic fatigue syndrome? So let's say that chronic fatigue syndrome is the same as long COVID. Let's just say. Is there a cure for chronic fatigue syndrome? Because long COVID is new, so maybe we haven't found a cure for that reason, because it's a new disease. But what about chronic fatigue syndrome? Since when has it been around? Well, according to the NIH, the chronic fatigue syndrome, it's been around since 1988. 1988? That's 36 years since its diagnosis. And there's still no cure? Are we even close to a cure? Well, let's take a look. Columbia University says there is no cure. NHS says there is no cure. CDC says, well, there's no cure. WebMD says, well, there's no cure. Mayo Clinic says, well, there is no cure. Healthline says, well, there currently is no cure. Wait a minute. Hold the phone. If you go on Raylan's channel on YouTube, and if you watch me, you watch Raylan already. Go watch her channel, Raylan Angle. How is it possible that on Raylan's Angle's channel, there are a whole bunch of recovery stories from chronic fatigue syndrome and long COVID? How is this possible? Hey, Raylan, have any pharmaceutical companies called you to see that, you can help them find the solution, the cure for long COVID or chronic fatigue syndrome? Oh, they haven't called you. Wait, none of them. Has any doctor called you, researcher? No, they haven't. Oh, that's weird. By the way, I made that up. I don't have Raylan's number. I'm just kidding. These pharmaceutical companies are that. They are companies. They're businesses. They're worried about their bottom line. And that's their job. I'm not going to be upset at them. They're just doing their job. If they can't profit the solution, why would they sell it to you? Why would they invest millions of dollars into art research studies to find a solution for this? They wouldn't, because it wouldn't make them profit. And that is their main job, to create profit for their shareholders. So what is the cure for long COVID? How did I and a whole bunch of people healed, fully recovered from long COVID or chronic fatigue syndrome? How did they do it? Well, according to the medical community and to doctors, there is no cure. So then you really start wondering, well, the people that did cure themselves or heal themselves, how did they do it? So before we get into the solutions, I want to talk about this parable. You've probably heard about this parable. It's called the blind man and the elephant. So there are these 6 blind men that walk into a village, and in that village there's an elephant. And one man touches the elephant and says, wow, this is like a wall we have here. The second touches the tusk, and it says, wow, there's like a spear, it's sharp. A third blind person touches the trunk and says, wow, it's like a snake. The fourth person touches the knee, and it says, it's like a tree. The fifth person touches its ear, and it says, like, wow, it's like a fan. The sixth person touches its tail, and it says, wow, it's like a rope. They all argued about, what really is this elephant like? A wise man walked by them and said, hey, you guys are all right. Stop arguing. You guys are all right. You guys are just touching different parts of the elephant. If you put all your parts together, you will get a better understanding. The blind men stopped fighting and stopped arguing, and they put their insights together to find out what really is the elephant like. The moral of the story is that we all have different perspectives. And when we combine that perspective, when we listen to each other, we can combine that together and get a better understanding of the problem. Sadly, our current medical system are like the blind men in the story. They all have their own perspective, and they don't want to listen to outside perspectives. So let's look into the different cures that there are. So there's different theories of cures as well. So let's go through a few of them. One is the Gupta program. And this really, the theory he kind of preaches is the amygdala and insula hypothesis. And I'm going to put a graph up there. And pretty much this is the hypothesis behind the amygdala and insula. And these are parts of the brain that has to do with fear. It's connected to the nervous system. And he believes there are 3 things that causes someone to have CFS or long COVID. That's acute psychological stress, predisposing factors, viral, bacterial, or other trigger. And somehow those three combined together causes dysautonomia. Gupta believes in the brain retraining process. He believes in retraining your brain so that your amygdala and insula aren't so sensitive and believing that everything is dangerous and pretty much calming your nervous system back to healing. Another theory of healing is mind-body syndrome founded by Dr. Sarnoz, and another person really well known is Dr. Howard Schubiner. And their cure, in a sense, is somatic meditation, positive self-talk, emotional processing certain past traumas, and looking at your personality type as a trigger. Another healing theory there is the cell danger response. They believe that when you believe you're in danger, your cells believe you're in danger, the mitochondria will start dysfunctioning, will start slowing you down. The theory that really resonated with me was the polyvagal theory. This theory says that we have three branches in our nervous system, that we have a shutdown phase, fight or flight, and a social engagement mode, which is the safe mode. And once I understood that in polyvagal, I just understood it. It reached my heart. I was like, this makes so much sense. And so you have to look at what makes sense for you. So remember, these are all just ideas. These are all theories. You really have two choices here. One, you can wait till the medical system comes up and finds a cure for it. Or two, you can do your best. Take control of your own life. Look at the people that are successful or in the places that you want to be. In other words, reach out to those people, listen to those interviews of people that have healed, listen for the pattern. People have different things. I'm not a big believer in dieting when you're healing. Some people believe in dieting, and that's okay. That's two different things. But when you're listening to these recovery stories, what are the same? What are similar stories? What are the patterns that they all have? And experiment yourself. The people that have healed are the ones that experimented over and over. They've tried different supplements. They've never given up. And it can be very discouraging because in the middle of your journey, you try these supplements, you feel like it works. All of a sudden, a week, 2 weeks later, you're back to your normal long COVID chronic fatigue syndrome self. And it sucks. You get discouraged, and that's normal. Don't give up. Keep experimenting. This is your life. If you're skeptical about all these different types of theories, then test it out yourself. Talk to your doctor, try out certain supplements. If they don't work, wrong. Cross that off your list. If you believe it's dysbiosis and you need to be on a healthy diet, try a healthy diet. If the healthy diet and probiotics don't work, or maybe get a fecal transplant, if that doesn't work, cross it off your list. If you believe it's blood clots causing long COVID or chronic fatigue syndrome, then talk to your doctor, see if they put you on anticoagulants or on apheresis, and if it works or if it doesn't work. And if it doesn't work, cross it off your list. If you believe it's autoimmune, then talk to your doctor, see if they could put you on some immunosuppressant medications or immunomodulators. And if it doesn't work, cross it off your list. If you believe it's viral persistence, then talk to your doctor, see if they can put you on Paxlovid. And if that doesn't work, cross it off your list. Or you have another option. You can go on Raylan's channel or on YouTube and watch all these recovery stories. You can listen to how people have recovered from long COVID and chronic fatigue syndrome 100%. I'm 100% recovered. You can watch my interview on Raylan's channel. You can watch my YouTube channel. You can watch other people's channel on listening to these people that have recovered. Look for the pattern these people have. A pattern I noticed between all these people that have been interviewed is they have self-compassion, self-love. They talk about reducing stress. They talk about personality traits and not being self-critical of yourself, not being type A anymore, not being a people pleaser or perfectionistic, meditation, breathing exercises, laughing yoga, brain retraining of some sort, being happy and accepting where you are despite your symptoms being annoying, being happy and extremely grateful, going through the grief process and, going through that process of being angry, sad, depressed, and then just accepting where you are. If you find a coach that you resonate with, reach out to them or binge watch their YouTube videos. There's a stud guy on YouTube. His name is Roberto Escobar. He's a stud. I recommend you to watch all his videos. Seriously, find somebody, a coach that you really resonate with. Just watch their stuff. You don't have to necessarily pay for a one-to-one, but just watch their stuff and find a coach that you really resonate with. You want to resonate with their message and with the messenger. And if you have the money, I remember I bought several courses. And to be honest with you, there's not one course I found that was magical, was this amazing course. It's really a combination of different courses and free information that helped me recover. So if you don't have the money, you don't need to buy a course. But if you have the money and the resources, maybe it's worth buying a course. Thank you so much for watching. Remember, I am not a medical doctor. I'm not a medical researcher. I'm just a random guy on the internet. I'm a guy that was frustrated with the medical community. Personally, I am a nurse. I understand the medical community because I've worked in it. And after getting long COVID, no one had answers for me. No doctors, no institution, no hospital. No one had an answer. I was frustrated. And if I waited for them, I would have never been healed or cured in a sense. So I'm just a guy who's sharing my personal experience on how I healed myself, how I've helped many people heal from long COVID. And I hope you don't give up on this journey. I know it can be frustrated, discouraging. Don't give up. That's my message. At the end of every video, I tell you guys not to give up, because if you don't give up and you keep going and you keep trying these different experiments, you keep trying these different things, it's going to be so sweet the day you recover. It's going to be so sweet when you can drive again. It's going to be so sweet when you can hang out with your friends and have no symptoms and get no post-exertional malaise. It's going to be so sweet when you have your cognitive abilities back. It's going to be so sweet when you can read, when you can watch TV, play video games, do whatever you want. Live your life. It's going to be so sweet to say, my God, I can't believe I had that nightmare of a life. 1, 2, 3, 4, 5, 6 years, whatever years, but I got my life back. There's nothing sweeter than that. So don't give up on yourself.